morning, everyone, or good afternoon, or good evening, wherever you're located. This is Siddharth Tambar, physician here at Chicago Arthritis and Regenerative Medicine. Today, we're doing our Wednesday webinar, and we are talking about GLP-1 agonist treatment for autoimmune patients. As I get started here, if you can hear me clearly, please let me know. If you cannot hear me clearly, or if you cannot see the screen in terms of what we have posted up there, please let us know as well. So today's topic is on GLP-1 treatments in the setting of autoimmune diseases. And this is an interesting topic because not only for myself, but for a lot of my colleagues, we are starting to think about what is the interaction between immune health and metabolic health? Because we're starting to notice with GLP-1 agonists that there is something happening in some of our patients for the good, and it's making us rethink how metabolic and immune health basically interact. Okay, so today's talk, we're talking about GLP-1 agonists and potential benefits for autoimmune patients. I say potential because this is very early kind of stage. And I think a lot of the details of how immune health and metabolic health interact is still a very early developing area. Actually I know someone who works as a researcher in that sort of area, and it's exciting, it's interesting, but it's very early stages. So what we know about our folks who've got autoimmune diseases is that it goes beyond just their presenting disease. So for example, a patient with RA may have painful swollen joints, but we know that they have the potential for other systemic issues. Most prominently is cardiac. We also know very well about how this affects energy level and causes significant fatigue. That may be, maybe the most common complaint that a lot of our autoimmune patients have long-term. And of course, how this affects quality of life. And metabolic health is an interesting tie-in, again, that we're just starting to learn more and more about. So some bigger kind of systemic things, we know that there is this association between autoimmune diseases and fatigue. Really one of the most common and severe symptoms experienced by a lot of our folks who've got systemic autoimmune conditions is fatigue and low energy, to the point that we know that this can make daily activities challenging and not easily resolved with sleep or rest, can involve both physical fatigue, mental fatigue, brain fog, can be associated with other kinds of mental health issues, as well as anxiety, depression, and even pain. And again, when you look at most of our autoimmune conditions, most of our patients will report significant fatigue that even affects their work. So it is one of the more common issues. And the reality is we have medications that work very well for inflammation. It's a little bit more of a mixed bag when it comes to treating some of these other symptoms as well. But we do recognize it as a part of dealing with some of these sorts of chronic inflammation states. So we know that autoimmune diseases has significant effect on health-related quality of life measures as well, whether that is affecting physical limitations, reduced daily activities. We know that it also has the potential to affect employment capacity as well. And fatigue and depression can obviously lead to significant diminishment in terms of quality of life, as well as relationships and overall human activity. So then you kind of come to, well, what is the connection here between metabolic health and autoimmune diseases and inflammation? So we know that autoimmune diseases, if uncontrolled, will eventually lead to cardiometabolic issues. In fact, we also know that with treatment of inflammation, you can reduce some of those cardiometabolic issues as well significantly. We also know that poor metabolic health can increase the rates of inflammation and can also predispose to autoimmune disease as well. So while we don't necessarily have a direct linkage, we have a whole lot of associations and a whole lot of high suspicion that these things are connected. Psoriasis is a very interesting model of this. And the reason why is because within psoriasis patients, you see some interesting associations. And of course, hard to say, are they just associations, or does one lead to the other, or vice versa? So psoriasis is an autoimmune condition where your immune system, instead of just protecting you from bacteria and viruses, is now miscommunicating and attacking the skin, leading to some very classic skin changes. So about 20% of psoriasis patients can also develop psoriatic arthritis, meaning that same inflammation can happen in the joints. That's what causes the joint pain. That inflammation is a big part of this. And you find a number of other interesting associations that psoriasis patients have higher rates of. That includes fatty liver, heart disease, fatigue, and obesity. And the curious thing is, psoriasis makes those things more prominent. And some of these things, such as obesity and fatty liver, seem to also be connected with also influencing inflammation as well. So there is this very complicated but strong association between metabolic health and inflammation. And we see that classically in psoriasis. And in fact, one thing that you'll notice in psoriasis is that as metabolic health gets worse, let's say as obesity gets worse, what you find is that psoriasis gets worse. You find that obesity in general, not necessarily just in psoriasis, but does seem to have an association with chronic low-grade inflammation and increasing certain inflammatory cytokines and chemicals. We also know that psoriasis and psoriatic arthritis tends to be more severe from an inflammation standpoint as people's BMI gets higher as well. And we also know that the effectiveness of traditional treatment for psoriatic arthritis and psoriasis with the typical medications and biologics that we use tends to be reduced in folks who are more obese. And we also know that weight loss on its own seems to help with psoriasis and psoriatic arthritis symptoms. So again, so many associations here that we're connecting between metabolic health and inflammation and vice versa. So let's talk about peptides. This is very early stages for where medicine will be going in the future. So peptides are naturally occurring molecules that act as signaling molecules in the body. Really what that means is that they're proteins in your body that tell other cells what to do. So what's interesting is that can we harness peptides to emphasize pathways in your body that are helpful and reduce other pathways in your body that are problematic? So this is definitely a direction that medicine will be going in, meaning that rather than just being a synthetic medication that your body is exposed to, this is a way of trying to harness the body's normal processes in a direction that'll get the kind of outcome that you want. So hands down, the biggest peptides out there right now are GLP-1 agonists. There are other types of peptides out there right now, not as well studied, some just in animal studies, some that may have very niche little areas that can be helpful in some medical conditions. But the biggest peptides out there right now are hands down the GLP-1 agonists. And that's really, that actually research started over 20 years ago by Novo Nordisk and has just grown like wildfire in the last 5 to 7 years. So GLP-1s are glucagon-like peptide 1. This is a naturally occurring hormone in your gut that regulates appetite, insulin secretion, and energy metabolism. So the ones that are out there right now that are currently being used are semaglutide and tirzepatide. These primarily work on GLP-1, but some of the newer generations of these do hit some other targets as well. They have an essential role in blood sugar control and insulin secretion. And because of that, they're approved for diabetes. And they also seem to have a very significant impact on metabolic health. So semaglutide and tirzepatide, and you've probably heard these by their brand names such as Ozempic, Wegovy, Mounjaro. These are GLP-1 analogs. They mimic the effect of naturally occurring GLP-1. And they're able to help promote improvement in metabolic health, namely blood sugar control, and then also in weight loss as well. So these are actually FDA approved for diabetes and weight loss. And again, they work in a few different ways. Number one is that they allow your body to more efficiently process and metabolize blood sugar in the bloodstream. They essentially slow down also your processing of food in the gut, so you tend not to feel quite as hungry. And they also seem to reduce some of the biochemicals that basically tell your brain that you're hungry. So they reduce that sense of food chatter as well. And so a really remarkable way of treating diabetes and a remarkable way of treating weight loss as well, or weight gain as well. And so they control appetite and weight through this brain and gut reaction or axis. And again, they do it by slowing down stomach emptying, reducing hunger sensations, making you feel more fuller sooner, reducing cravings for food as well. So approved formally for type 2 diabetes and chronic weight management. What's interesting is that you're seeing studies that are showing, look, can this be helpful for other conditions as well? So in the literature that's being reported right now, there are people talking about, can it be helpful to prevent cardiovascular disease? What about prediabetes, someone who's more prone to diabetes? What about neurodegenerative conditions? There's an actual study out there showing that folks who are taking semaglutide that also have Alzheimer's seem to do better and respond better to medication than those folks who are not taking semaglutide. Because of that, there's a lot of excitement about what is the possible role for GLP-1 or similar peptides when it comes to anti-aging and metabolic syndrome. Metabolic syndrome is basically where someone who has the risk factors for cardiovascular disease, that would include prediabetes, high blood pressure, fatty liver, high cholesterol. Those folks have dramatically higher risks for heart disease and other cardiovascular issues as well. And so if you know someone has a higher risk for metabolic syndrome, either through family linkage or because of they may have some early signs of metabolic syndrome or higher risk for that based on how they're presenting at an early stage, can you actually prevent that from happening? All this is very early stages, but this is what some doctors are very excited about. When it comes to peptides, generally, at least the ones that are out there right now, they're given in a once per week self-injections format. You start on a low dose, slowly escalate monthly as needed, monitoring your weight, your appetite, observing for any side effects, and monitoring your metabolic health labs every 6 months or so. For those folks that already have diabetes, you're likely monitoring your labs a little bit more frequently, just to make sure everything is staying healthy as well. So when it comes to metabolic health effects of GLP-1 agonists, we know that these can help to reduce weight by 15 to 20%. We also know that you can actually reduce significantly the risk for major cardiovascular events, things like heart attacks and strokes, not only diabetics, but also in autoimmune patients. That's actually been reported. So this is where it starts to get exciting for rheumatologists. There is a significant benefit that GLP-1 agonists have in terms of reducing inflammation. We don't fully know why that is. But we do know that in folks with autoimmune issues that are taking GLP-1 agonists, there seems to be a reduction in inflammatory parameters like C-reactive protein. We do know that it can help to reduce pro-inflammatory cytokines, meaning the chemicals that are associated or drive inflammation in the body as well. And we know that some of the pathways that are involved in inflammation seem to be modulated or suppressed when people are taking GLP-1 agonists. In animal studies, they've taken that even one step further, and they've more formally shown that there's actually a reduction in the actual inflammation in the joints as well. Again, that's animal studies, different than humans, a lot more controlled, but again, very suggestive that a lot of what rheumatologists are seeing, which is that there does seem to be some benefit with GLP-1 agonist therapy in some of our autoimmune patients. There may be something to that. Now, realistically, we don't know what's actually going on here. We don't know if GLP-1 agonists are directly doing something to the immune system that is calming things down, or because it's working on the metabolic health system, that in turn is influencing the immune and the inflammation system of the body. Again, we do know there is that connection between metabolic and inflammation and immune system. And so we're not exactly sure the mechanism of what's going on here, but again, early stages, rheumatologists are noticing some interesting things. GLP-1 agonists seem to also have some potential effect on fatigue as well. Again, why is that? I'm not sure if that's because it's improving metabolic health or reducing obesity or doing something to reduce inflammation as well. We do know that GLP-1 agonists in some studies have shown that there may be some neuroprotection in folks who have neurodegenerative diseases. So people have postulated if it's reducing fatigue and even brain fog in some of our autoimmune patients, maybe there's something neuroprotective there as well. Again, that is more hypothetical, hypothesizing, and sort of considering what could be a mechanism of action. But it's an interesting idea. And then, of course, reducing the risk of major cardiovascular risk events, even in people with autoimmune diseases, is something that we see. I think if you think about autoimmune patients, because of their systemic inflammation, because they're at higher risk for cardiovascular disease, we should be thinking more and more preventatively. In the past, rheumatologists were very focused primarily just on the inflammation component of trying to help people out. What we're starting to realize is that maybe we should be thinking about prevention when it comes to cardiovascular disease as well. It seems obvious saying that now, but the reality is, in the past, I think rheumatologists were more focused on just the inflammation part. And frankly, realizing that controlling the inflammation helps reduce some of those cardiovascular risks is very encouraging. And I think seeing that there are possibly other ways to improve our patients' health as well with some of the available tools is exciting as well. So this is the too long, did not read slide about how GLP-1 agonists could be interesting in our autoimmune patients, because can help with metabolic health, can help with weight loss, can help with fatigue, and seems to be helping with inflammation, even though we don't fully know why, but seems to be having an effect there. So now from a practical standpoint, so how do we actually use or introduce this to our autoimmune diseases? I think right now, the way to think about this is as follows. You can't think about GLP-1 agonists in someone who has rip-roaring bad autoimmune diseases as that is a alternative treatment. I think realistically, you have to look at it as, first and foremost, if you have very significant autoimmune issues, you still have to use the tried and true proven treatments. The ones that have data that's going back 20 plus years, like that's realistically what we have to rely on, because those work. And when you look at the data between folks who had these conditions previously compared to now, patients who have access to these treatments, it is life-changing and dramatically better. So still have to rely on the traditional treatments. But I think you can consider GLP-1 agonists in our patients for the following. Can help with weight loss, for sure. May also assist with mild residual inflammation in the joints. May assist with some of the residual joint pains, and certainly could also help with persistent fatigue as well. And didn't even touch upon, what about the potential to have some preventative effect in cardiovascular disease? I think there is something there to discuss as well. I think realistically, if you have a chronic autoimmune issue, the first thing is, okay, make sure your inflammation is controlled with traditional appropriate treatment. Then make sure you maximize all your lifestyle factors that you have some significant degree of influence on. And that includes the basics, things like exercise and nutrition. And if you're doing anything else, I mean, all the other obvious things. Are you smoking? Are you drinking too much alcohol? Any drug use? All those other kind of obvious ones. But then I think after all that, then you start thinking about, well, what about a GLP-1 agonist? Would it have the potential to possibly be helpful preventatively? It's an interesting idea, something to discuss with your physician. And I think it's probably a worthwhile conversation. Some more important things to know about some of these treatments, at least for the GLP-1 agonists. Side effects are generally low, but with any medical treatment, there's no such thing as no side effects. GI discomfort is the most common side effect, which makes sense. It works on the gut. And of course, you have to be cautious if you have a personal or family history of thyroid cancer. There's some thyroid cancer types that your doctor needs to know about before starting this kind of treatment. Also know that treatment is generally via a weekly injection. Also understand that treatment duration, I generally recommend at least start with 6 months. And the reason why is because you generally start on a low dose and slowly progressively increase it as required. And also understand that the best results that you're seeing when it comes to metabolic health is for people who are taking this long-term. And then the last part of this is, look, realistically, if we're talking about this from an autoimmune patient standpoint, this is off-label. And so your treatment, if you do not meet criteria for the existing indications, namely diabetes or significant obesity, is that you'll likely need to procure medication via compounding pharmacy, and your physician should help out with that. Other things to know, there's no such thing as fully benign treatment. Like, even though this works, emphasizing your normal GLP-1 pathway, you need to understand that you should be keeping an eye on your metabolic health labs every 6 months or so. And again, much more often if you're a diabetic. And your physician really needs to be comfortable with treating not only your metabolic health, but your autoimmune disease as well. What I mean by that is, if you're trying to pursue treatment for your autoimmune condition with something besides the traditional medications, and you're trying to think about using a GLP-1 agonist, I don't think there's, I think you just have to be aware of the risks of avoiding traditional treatment, the benefits of maybe alternative treatment, but also know how do you observe whether or not that alternative option is adequate or not. And so your physician really needs to know what they're doing here from the autoimmune standpoint as well. Otherwise bad things can happen, right? Like your condition can worsen if it's not being managed appropriately. Okay, wonderful. Let me just pause for a second, look to see if there's any questions at this time. Okay, good. So we've kept this short and sweet today. If there's any questions afterwards, please shoot us. Oh, there we go. Good question. Can you address weight loss without? Where did that question go? How do you? Okay, good question. So weight loss without muscle loss. The reality is that if you have weight loss, it's not like your body knows to only take it out from fat cells, right? Like, you end up having the potential to lose muscle loss as well. So how do you combat that? Number one, again, you have to optimize everything on your end in terms of lifestyle, nutrition, maximizing in terms of macros, in terms of micronutrients, in terms of exercise. The person writing this, I know they already do this, but have to be obsessed about that. I can tell you that this is an interesting question. So there's actually a pharma company out there that is studying using a GLP-1 agonist with another type of pharmaceutical to help protect the muscles as well. It's an interesting idea. I think it would be preferable if we didn't have to add on another medication, but I think it is primarily a matter of lifestyle at this point, that you just have to do everything you can to help promote muscle maintenance or muscle gain so that you don't actually lose muscle. All right, GLP-1 and lupus. Not really any data published out there on GLP-1s and lupus. There's actually data on GLP-1s and RA and psoriasis and psoriatic arthritis. But I mean, we certainly have lupus patients that are also taking GLP-1 agonists. I think it's low risk and safe. I think a lot of this depends on what sort of lupus that you have. There's versions of lupus that are incredibly mild. And I think combining GLP-1s with some of the milder lupus treatments is fine. I think if the question is using GLP-1s in place of some of those treatments, might be okay. It just depends on what kind of lupus you have. There's versions of lupus that are incredibly severe and life-threatening. Those versions, I would say you have to be strict in terms of staying on the traditional treatments. I think when you think about some of the high risk of cardiovascular issues that lupus patients have, after overall inflammation is under control, I think when you start talking about how do you think about preventing cardiovascular disease and treating metabolic health, I think GLP-1s are an interesting option to put in a conversation for lupus patients as well, for sure. My sense is that over the next couple of years, you're going to see more and more data coming out. Just the sheer number of people taking GLP-1 agonists right now is so many. And there's data being collected on a lot of these folks. And so the nature of how medical research works is that at some point, somebody will start cutting the data and saying, well, what about this condition for people who are taking GLP-1 agonists? What happens if they took it? How did that affect things as well? And so you'll slowly over the next couple of years, intermittently, probably every couple of months, start to see more and more data on how GLP-1 agonists are benefiting our autoimmune patients as well. I think probably over the next 5 to 10 years, you're going to end up seeing even more when it comes to that connection between metabolic and immune health. Again, I think typically right now we think of it as someone who's got chronic inflammation. What is that doing to their metabolic health? I think over time you're going to see more and more. Okay, we've got someone with some inflammation issues. Why don't we attack it with some metabolic health interventions as well, from like a pharmaceutical side as well. And so I think we'll see more and more of that over the next 10 years, which will be interesting, meaning treatments that are not necessarily immunosuppressive, but still have a significant effect on the immune health, but going at it from the metabolic health route. Okay, good. Yeah, great question. GLP-1 and osteoarthritis. Yeah, look, if I think especially for folks who've got lower extremity arthritis, namely knees, hips, feet, ankles, even lower backs, we know that if someone has, if their weight is above maybe their optimal kind of ideal level, that losing weight can significantly help in terms of osteoarthritis pain and symptoms as well. So for example, for something like the knee, we know that if someone is above their ideal weight, that every pound of weight that is lost results in 4 less pounds of weight on the knees, which then results in dramatically more pain relief as well, which is why weight loss is such a critical part of treating osteoarthritis as well. And that's wonderful. Yeah, just one of the viewers right now saying that they've got lupus and osteoarthritis, and knee pains and swelling and inflammation are dramatically better with using a GLP-1. That's fantastic. That's pretty exciting to hear. Again, I think in the right person, I think it has tremendous benefit. And I think we're still trying to figure out the ideal ways to use this. For the way a lot of physicians think, we tend to think in terms of algorithms in some ways. And so, the algorithm that has traditionally been utilized for, let's say, autoimmune conditions is here's a stepwise therapy of progressively stronger and more effective immune mediating treatments. I think it'll be interesting to figure out where do we fit in the GLP-1 agonists and other peptides in the future for our autoimmune patients. For osteoarthritis patients, I think that's fascinating. I think if weight loss is something that someone has stalled at or is having difficulty with, I think GLP-1 agonists should be thrown in at a relatively early stage because of how well we know they work for weight loss and how much we know weight loss helps with lower extremity osteoarthritis symptoms. Very good. Okay, wonderful. If no other questions at this time, I'm going to start to shut things down here. And if you have any other questions in the future, please email us or contact us via any of our social media sites. In addition, you will get a copy or a replay of this probably in the next couple of days, and you can either rewatch or share with anyone who you think would benefit. So thank you everyone for your time today. And until we connect again, I hope everyone stays safe, healthy, and continues to live well. Bye-bye.